Hello, everybody. My name is Isaac Perez. Uh, this is my presentation for Psychology 101 on obsessive compulsive disorder, otherwise known as OCD. So first off, what is obsessive compulsive disorder, OCD? There's a lot of stereotypes and misconceptions about it. This term is very heavily used in our everyday language, whether we're using it to describe, friends, family members, coworkers, anybody who seems to have a pattern of behavior where they're very excessive and repetitive in terms of keeping things clean or having things orderly or be having phobias that have to do with germs and stuff like that. But it's much more complicated than that, and it is a very serious psychological disorder. So first off, what is OCD? It is a chronic psychological disorder that features an individual that suffers from uncontrolled and reoccurring thoughts that are manifested in certain behaviors that are both intense and repetitive. These thoughts are triggered by both mental and physical images, which lead the individual to behaviors that are excessive and repetitive. So, for example, someone may feel the need to routinely wash their hands or have certain things in a certain order or a certain way. And sometimes it's so debilitating that people can't leave their houses without doing these things, or they can't go to work, can't leave the home, they can't get in the car without having these behaviors that almost sort of seem very ritualistic. So it's not just being an orderly or a clean person, even excessively. It's when it manifests in a very uncontrolled and reoccurring manner. It's very intense. In terms of a diagnosis and classification, according to the DSM-5, two of the main features are recurrent and persistent thoughts, urges, or images that are experienced at some time during the disturbance as intrusive, unwanted, and that in most individuals cause marked anxiety or distress. And also, the individual attempts to ignore, suppress such thoughts, urges, or images, or to neutralize them with some thought or action. So this isn't just, like I said, about being orderly or being clean or being repetitive and excessive. This is when it gets to the level where it's uncontrolled, where it's debilitating, where the quality of life of the individual is going down. They can't make it to work. They can't leave the house. They can't fulfill their obligations because these images and these anxieties are just so intense and so overcoming. Just a little bit more on the diagnosis and how an individual can get diagnosed with OCD is typically an individual will undergo psychological evaluation in which the patterns of behavior, thoughts, anxieties are considered and weighed in conjunction with the quality of life. So if these behaviors and patterns are interfering with the person's life, that is considered. And also, an individual's family and friends may be consulted for additional information and questions and behavior and aspects of their quality of life. So sometimes it's not just getting the perspective of the individual who's afflicted, but also seeing how from others who are connected to this person, how their life has been affected. And aside from the psychological evaluation, consulting with the individual's social circle, a physical exam may also take place to rule out any other underlying health-related issues that may cause anxieties or any drug use that may cause certain behaviors. So they want to rule out anything that may cause this, from an external standpoint, in terms of drugs or any health-related issues. For some of the causes of OCD, according to the National Institute of Mental Health, there appears to be a connection between the size of certain regions of the brain, such as the frontal cortex and subcortical substructures, but there is no conclusive connection yet determined. Other factors that have been mentioned and brought up are low levels of serotonin, which is a key to mental balance, and I think most importantly, and there seems to be much more consensus, is environmental and developmental factors that have been linked to OCD, such as childhood trauma, other traumatic experiences, the whole childhood of an individual. Many times these behaviors and patterns and the OCD itself get picked up from a very early age. So a lot of the environmental and developmental factors seem to be the common denominator in individuals who get diagnosed with OCD. In terms of the treatments, there's cognitive therapy that focuses on reorienting the thoughts and images that trigger anxiety or distress. This is said to help reduce the intensity of the thoughts, which may lead to improved quality of life. So just going back and working on those triggers and things that cause the responses and going over it to a point where you can reorient and redirect these things. Exposure and response therapy is having individuals being exposed to a lot of these things that cause anxieties. For example, if somebody has a phobia to germs or cleanliness or something of that nature, they may expose this person to germs and just have them not wash their hands and do this repeatedly so that the behaviors and the patterns sort of lose their intensity. And then a third treatment is antidepressants, and this is in order to achieve balance. Like I had spoken previously in the previous slide about low levels of serotonin. But one issue with this is that it may require longer periods of time and larger doses than other disorders such as depression or other anxieties. Also, some of the misperceptions of OCD is that, this is not necessarily something that's super common. It is about 1% of the population, but also that it's very intense. Like I said, it's a term that we use a lot in our everyday language to describe people who have these behaviors. But when it comes to being diagnosed with OCD, these are uncontrolled, these are very excessive, and these are manifested in ways that debilitate the quality of life for an individual. So if somebody's just excessively clean, it may just be a personal characteristic of that person. But when somebody is exhibiting these characteristics to the point where it's affecting their quality of life, and when it has been going on for many, many years, many times from childhood, then there may be a possible OCD diagnosis. So it's fairly different. It's not as common as we make it out to be, but it's also not uncommon. And another misconception is that a lot of OCD does not happen just in and of itself. A lot of it is tied to other psychological disorders, depression, anxieties, PTSD, other disorders of that sort. So there's definitely a lot of literature, a lot of studies out there, and hopefully this was just a nice overview to give everybody a bit of an introduction to the subject. And if they know anybody that's dealing with these issues, that there's a lot of information and resources out there for people to interact with and engage with. But that'll just about wrap it up for this presentation. So thank you very much.